Agreed to, and I call the member for Fowler.
Thank you, Deputy Speaker. Access to affordable medical care is one of the most important qualities that we have as Australians, and our general practitioners are at the forefront of this. They play a critical role from early detection of diseases and intervention to guiding patients and their families through difficult medical conversations, through a lifetime of immunisations and checkups, and managing the ageing process. In my community in Fowler, the work of GPs is more challenging with language and cultural needs, as well as cultural beliefs. Over 70,000 people in my community live with a long-term health condition, from stroke, diabetes, arthritis, asthma, cancer, just to name a few. It is against these increasingly diverse health needs in the community that many GPs find themselves working in, and it's a particularly challenging job for many, as they are the primary caregiver to their patients and the gateway to other specialists through their referral role. They take on a lot of responsibility for the professional diagnosis and treatment, and they are integral to the administrative processes that ensure continuity and follow-through in patient care. Like many things in our society post-COVID, the healthcare sector has faced and continues to face many challenges. The shortages of GPs, especially GPs who offer bulk billing services, is a critical one. This is not merely an inconvenience, it is a symptom of a deeper malaise in our healthcare system, a shortage in the supply of GPs that is fast becoming a crisis. I recently met with the CEO of the Minet group of companies who represent numerous smaller GP practices. She informed me that in the past year and a half, at least 30 GP practices have closed in southwest Sydney area alone. Of the practices that remain, many are facing an ageing profile of practitioners who are nearing retirement. This is not a temporary shortfall. It is a chronic and worsening shortage. To address this, we must look at increasing the supply of qualified GPs, especially those incentivised to bulk bill. While we take comfort in the rigorous process that produces highly qualified doctors, we must also acknowledge that there are qualified medical graduates among us, trained overseas, who are waiting for their qualifications to be recognised so that they can contribute and fill the gap that our health system is experiencing. Surely our Australian medical health system can find solutions to bring on these overseas trained and qualified doctors by assessing factors such as the costly exams and the requirement to spend 10 years living in rural regions, or the supervision requirements that seem overly bureaucratic and onerous. In my electorate Fowler, with its high migrant and refugees population, there are doctors who could be serving our community's needs for GPs. While I understand the necessity for English language proficiency and a review of the courses that study pass, surely we can streamline this process. These doctors are much more likely to seek to open practices and stay in the communities where they, their families and friends live. Another means to increase the supply of GPs would be to review the professional qualification process that awards the specialism. The decline in medical graduates choosing general practice from 65% to just 12% is alarming. The 4 to 5 year additional training period required to specialise as a GP is the same time commitment with other specialisations that offer much higher remuneration. It is incumbent upon medical associations, with input from government, to reassess this process and align it with the healthcare needs across Australia. The socioeconomic disadvantage prevalent in southwest Sydney makes the area less attractive for new GPs due to a preference for bulk billing, exacerbated by the inadequate indexing of patient rebates. This indexing requires urgent review to ensure that areas with the poorest health outcomes can support more bulk billing practices. Yet, southwest Sydney has and will continue to experience great population growth in the coming years. Not only will a significant increase in GPs be required, but also nurses, allied health professionals and specialists to support the multidisciplinary teams. We need changes to incentivise existing GPs to bulk bill patients. The current cost of living crisis, the stagnating economy, the wallet emptying inflation overseen by this Labor government means that many Australians will place food, clothing and fuel costs over their health. This is a false economy, as delayed health checks lead to worse health outcomes and high costs in the long term. I'm committed to engaging with the Minister for Health on these concerns and working towards a sustainable solution to ensure the health and well-being of our nation. Thank you.